So we're going to call our meeting to order. Our first meeting of the Health and Environmental Services Committee in like 20 years, is that right?
No, come on, we had them last year. What you talking
Rec
about?
funding last year.
You know, it's all rec funding, man, you know?
I
We
was
got to
told,
have
Watts,
some-
we're
No
going to,
moss, no moss in the rec funding.
Yeah,
this
well,
year.
he even came into one of our meetings when he was, you remember?
yeah.
you
Oh,
did.
that was this committee?
This is this committee.
Oh,
man.
yeah.
Yes, it was.
I think it was this committee.
Already got a
that
bad
start-
taste in my mouth
I
now.
think it was-
Yeah.
I think it was this committee that started the facelift out at Ebenezer Park, wasn't it? This committee would have done that?
Probably.
Yeah.
I was
Yeah.
on it then with me and Chad and somebody, so.
Oh, yeah,
That's
we-
our parks go through here.
Yeah.
All right. Well, listen, here's the deal. I actually did earmark 1 hour and 15 minutes for this meeting today. Swear to you. No, seriously, 1 hour and 15 minutes for this meeting. Because we've got a lot of discussion. I hope we can do it in less. And I don't know how many meetings it's going to take for us to get to a recommendation or takeaways. It could be 2, it could be 3. But I'm going to be honest with you, I'm not in a rush. I'm more interested in getting this done right. So before we get started, let's have an invocation. Does anybody want to say a quick prayer for us? Anybody want to volunteer?
Yeah.
You got it,
All
Tom?
right, yeah, I got it. Lord, thank you for us to be together to make decisions of the community, Lord. Please guide us on our decisions and guide this meeting, Lord. We love you. Thank you. In Jesus' name pray. Amen.
Amen. Thank you. All right. So normally what I do is I introduce guests that are in the room. Lisa, you're outside the table. We appreciate you being here. I think everybody here knows who you are. How long have you been with the county?
Longer than I'm going to admit.
There you go.
People start adding up, deciding how old I am when I tell them how long I've been there, but I've been here a long time.
A long time. All right. Well, we appreciate your service in HR. Thank you. So we've got some important issues to discuss, and in my mind, I have broken this up into 2 conversations. Okay. First one's going to be pretty easy, and I think we can hammer this one out quickly. The second one, as I shared with Kevin, I think that there's some education to be had with the second topic. We've got retirees that are pre-65. We have retirees that are post-65. So as we talk through options, it's just going to require a lot of questions asked to Kevin and maybe even to Lisa through Kevin. Okay, and then I think ultimately we could come up with some solutions that are logical, right? Have no idea what that's going to look like. But let's start out with this first, because I think this one's going to be the easiest to tackle. So one of the things that I remember reading when this came up about the retiree coverage is not just the financial implication to the employees, but how they heard about it. So that one's an easy one to fix. So I want us to tackle that one first. Y'all okay with that?
Mhm.
Okay.
Good.
All right. So what I thought about doing is first of all, we're going to draw up here this circle. And when does the policy renew? What month? January?
You have an open enrollment is in October. The years start January.
January. So premiums change first pay period in January.
Correct.
All right. So here's what we're going to do. We are going to put January here at the top, because that is the RN stands for renewal. Okay? I'm going to move out of the way in just a minute. So we got April, we got July, and over here we got October.
So that's when it starts, right, Lisa? October, open enrollment starts in October?
You got 1 month of open enrollment.
Okay, open enrollment, I'm calling OE, open enrollment, okay? So we've established that the renewal's January, meaning that once a year, your health plan has a guaranteed rate, right? So the employees have a calendar year deductible that runs this way. And in October, you have open enrollment for employees to make their decisions. How long do they have to make their decisions?
1 month.
So open enrollment's going to close November. Now, when do you get your renewal increase?
We find out during the budget process, and I'll just give my whole spill on this, because we talked about this earlier today. We find out during the budget process what the projected
Is that
increase will
July?
be. Well, June 30th is the end of the year. July 1 is when the next year starts.
So when's the state tell you?
We know about that in the spring. What I was
Spring.
gonna recommend doing is over here, July 1, once the budget is settled and approved. We
Wait
won't
a
know
minute,
the
don't get
exact
ahead.
numbers.
Don't get ahead of solutions yet. Let's ask questions. I appreciate that.
Okay.
Let's, we all need to catch up with where you are, and we're not there yet. Is that okay?
Fair enough, sir.
All right. Now, So you're saying in the spring, you get notice of what the definitive increase is gonna be for January first?
You get an estimate of what it might be, then you get a definitive number later. And those are, let's go,
Let's say we're talking about 1/1/24, because we're looking ahead. When do you think, you're gonna get a tentative number at some point in the spring?
we'll know the number for sure in probably the April timeframe, I think, is when we know what the expected percent increase will be.
Every April, sometimes it's May, sometimes it's March,
Approximately April, let's just say.
but you're
April.
definitely gonna have it by July.
Yes,
Okay. So this is when you're putting your budget together between June and July, is that correct?
the budget is approved in June,
Approved June first meeting in June?
first meeting in June.
Okay. All right, so that's a good touch point. All right, first meeting in June.
We've known to be over in the middle of June.
So let me ask that leads into my next question. How long does council, I've never done this before, how long does council deliberate on the budget?
You'll start beginning of April, you'll have your first budget workshop. And basically from that time until then, you're going through workshops, public hearing, first, second, third reading.
So you have a budget workshop that goes from April to June, and probably the first meeting in June, we vote on the budget. Sometimes it goes over, you're
No,
saying.
you have first to May, you'll have first, second reading. The budget calendar is set up to have the first meeting in June, and that's done intentionally because if something comes up and you need to defer it,
Yeah.
one meeting, let it slide one meeting, we have a built-in cushion in that.
So
Yeah.
back up and help me with this. You're saying the first reading is in May?
May first.
And
No,
then
no,
the
no.
second
First-
reading is
first
the
Monday.
second?
First Monday.
And
You
the
have to have
second reading is the
ordinances,
third Monday.
3 readings, public hearing. First and third Monday in May are
Yep.
first and second reading of the budget.
Okay,
There's a separate standalone public hearing for the budget that takes place during there as well.
okay.
So one of those off weeks.
That's gonna be after second reading of the budget,
Yeah.
before third reading. Then you have third and final reading of the budget. The budget calendar has it for the first Monday in May.
Okay.
Or, I'm sorry, June.
June, but it could go to the second meeting depending on.
I think
what
it's only happened
controversial
once
is.
since
Yeah,
I've been
we-
here, but it can happen.
Okay, so what we've established now is that our renewal is January first. We're gonna know probably by the end of June, before our budget starts over July first, what we need to bake into our budget and what's gonna impact the employees, right? Okay. You got open enrollment in October. So, again, what I read in the communications emails that I was reading was the complaint over communication. We didn't communicate the renewal properly to retirees. So then the question would be, in my mind, and I don't mean to take all the air out of the room, fill in, tell me what you're thinking, but seems to me that sometime between here and here, July, August, September, before we get into October, the month prior to, this is probably our communication point of what to expect.
I was gonna suggest in July 1, we would not have a definitive number because the open enrollment hasn't come yet, and the actuarials are the ones that can give you a precise number. But we should have an educated estimate, a pretty precise estimate of what the increase would be. We could notify the employees July 1, there's an expected increase of approximately this much money, okay? And we can break it down with different categories. Qualify that this is not precise, but we expect an increase of approximately this much. Let them know, then send out another reminder before the open enrollment happens. After the open enrollment, we'll get back the actual numbers from the actual, and the actuarials will crunch the numbers. And that, they normally come back in the November time period on that, correct, Lisa?
Yes, sir.
After
Okay.
you've had an open
But-
enrollment, they come back and they can change your numbers?
The retirees, because of the age factor, that changes, okay, what they're, because it's the actual
Okay.
cost.
This is a good pivot, real quickly. Are you telling me that there's a renewal increase for your general population, your working employees, and then there's a renewal increase that could be different for retirees? No.
The retiree cost of insurance, okay, health insurance, the actual cost of health insurance for somebody that's 60 versus somebody that's 30 is different, okay? There's an implied subsidy when you're giving them, okay, you can keep our same insurance. So they're not paying as they get older, at least you chime in if I get this fast wrong, as they age,
Okay, wait a minute.
They'll
We're gonna
naturally
get-
start
We're gonna
paying
get to
more.
this in the next conversation. Let's stick to this right quick.
okay?
So you're saying, and we're here to talk about retirees, but you're saying that, now you're saying, I hear you saying that in July, you really don't know for sure what the premium increase is from the state, or you're saying we haven't decided at the county what we want the increase to be to the retirees?
Neither of those things.
All right.
What I'm saying is, we know what we're gonna contribute to your health insurance, Watts.
Mhm.
I know what I'm contributing to your health insurance,
Mhm.
okay? I know what Tricia's health insurance costs went up for the county. I don't know for sure what your portion of that, your cost is gonna be for you. So it's that delta between what your actual cost is gonna be versus what the contribution, that's what the retiree pays.
Okay, now I want you to think about something though, but you're saying we got open enrollment in October, and you're saying we don't know definitively to November. They've already enrolled for coverage. That means somebody could enroll for coverage, and in November find out what the number is and not be happy with it, and have to reverse their decision and now go pick coverage up with their spouse on their plan, because they're not happy with it for their dependents, let's just say.
But we're talking about retirees.
Yeah,
Yeah, on the retirees.
but the retirees still have open enrollment too.
Yeah, but it's for
Police, the
picking up.
retirees have open enrollment, and again, the rub in this, Watts, is the actuarials until we actually know who's in what version of the plans,
So-
because when you're over 65, you got two different choices you can be in. Until the actuarials know that actual number, what they've selected, they can't give us back the actual cost.
So I think this is your issue. This is why people were complaining, probably is because you didn't know for sure until after
Right,
open
and
enrollment.
again, what back to my solution is here, just because we didn't know for sure what the answer was,
Mhm.
I could have given you a pretty good educated guess on what the increases
Yeah,
are gonna be,
I agree.
okay, beforehand.
Yeah, so how is this, so what was the general complaint? Was it the cost or was it the lack of a notification?
Well, I read both.
You
So
heard
we're gonna
both.
tackle
You
this
heard
one
both.
first, and then we're gonna go to the second.
Okay.
That's the next conversation. This
Question.
one's easy. We should be able to wrap this one up in just a few minutes.
Have retirees ever known before the close of what the exact number was gonna be, or was it always kind of like an approximate?
It's always been about the same time period,
Okay.
October,
Mhm.
November.
So I think with your plan of giving them a ballpark estimate, but give it to them sooner.
You give them a heads up, that takes away this whole complaining,
Yeah.
right? I mean, Lisa, I don't believe we've ever had retirees say, you know what, don't like the plan, don't like what you're doing for me, I'm gonna go
Mhm.
somewhere else. I just don't, that really doesn't happen.
Yeah.
They're gonna be enrolling, we can't give them that precise number to the actuarials weighing on that, but we can certainly give them a heads up, and that'll take away that complaint about, oh, I didn't know this or that was coming.
Exactly. Don't you have a newsletter you put out once a month in the county too?
That's just for employees that the county manager's office.
It's not
does.
really,
It's not really out.
It's more
It's not like that.
pictures.
Okay, all right, so it's really not.
sorry about, here's all the graduations of the
Yeah,
graduating kids and
all right,
that kind of stuff.
yeah. I'm just thinking of ways to get the message
Yeah.
out.
They're all sent letters.
I'm thinking though, and I don't know where you all are, but going into open enrollment, there should be a definitive number. There should be no question that it's gonna change. We need to arrive at a number and stick with it. It's the number for a year. So if anything, you estimate higher than lower. Because you can't get someone to go into open enrollment thinking it's gonna be one number and it changes, whatever, $5, $10 or whatever it's gonna be. It's just, that's avoidable.
But can you?
The cost, and Lisa, you've worked with the actuarials on this, they're the ones that weigh in on that, they do the calculation what the number is, okay? And they need to know the ages of everybody participating in this, to be able to do that. We can't have that information until the open enrollment.
It closes, till it
Until it
closes.
closes, right.
So, I mean, and that takes them weeks to get that number back to us.
Okay, let me ask a question then. This year, you had a, what percent increase? State of South Carolina had a what percent increase in cost? What was it, 12%?
At 18.
18%. All right?
Across the
What-
board.
Across the board, yeah, which was a $1 million impact to the budget, is that right?
It was a very significant number of the budget, yep.
All right, so 2022, you had 18%. Do you remember what it was for 2021?
I think 21 was 3 to 5%, something like that, Lisa?
It's much smaller.
Yeah, I think 3%, something like that. And
Any
they
idea,
had
any idea what 20 was?
somewhere around the small number again. You had
19?
small number again, going back many
18,
years.
so you haven't had an 18 or anything percent increase, they've always been between 1 and 5%.
I won't say definitively, I can't go back to the 2015, but yeah.
Probably, yes.
They've been small numbers, and this was, you know, really this was people trying to recover some costs, and the legislatures wouldn't fund them, so they stuck
Okay,
with us.
Bump's got a question.
I was just gonna say, just looking at, knowing that it jumped 18%, and looking at the previous years, not seeing those kind of jumps, I think that's the sticker shock for this go round is making the gripe.
Well, there's gonna be
more
another
stuff.
sticker shock come up next year too, because they're expecting like another 12 to 50% increase.
And that's,
What PEBA's been floating out there right now.
and these costs are apparently out of our control.
Well,
Right now, we are with state-owned insurance. I'll let you know, the Association of Counties is doing an RFP to go out and shop and get different healthcare. I am a firm believer that there's a better option out there right now than what we have. The way that PEBA's funded, I'll give you an example, school teachers, school districts, you have to be in state retirement health insurance. So the legislature's funded a subsidy for the schools, so they didn't have to take that big hit,
So the teachers didn't have to take the hit.
or school districts.
That's good, okay.
So municipalities and counties and other government entities that are participating, you know, the way I look at that, that cost is shifting over to us. You know, Association of Counties is working with other large counties, and I hope they work with Mississippi Association as well to try to get together a competitive package, and we have some options to look at.
All right. So what we have not answered is, when on this timeline can we provide retirees a definitive cost of what their premium's gonna be?
That's gonna be the same time as it's always been, when we get the.
November?
next
Close.
In November is
Well, then I'm
typically
gonna make
what
a
it's at.
suggestion that maybe we consider letting our regular staff have open enrollment in October, cause you know what that number's gonna be, it doesn't change, right?
Unless we hire somebody after that.
It'll still be the same. Your number for your employees for your county currently, when they enroll here, does their number change too?
The cost for the employees that are working here, we know that number July 1.
What the states, assuming we don't move the insurance, we stay with the state of South Carolina, we got an 18% increase. Our full-time employees, when they enrolled for coverage in open enrollment in October, they knew what their premium's gonna be, and it did not change in November, correct?
Yeah.
Okay. Why don't we consider letting this be open enrollment for full-time eligible employees, and let this be open enrollment for 1 month or 2 weeks? You don't have to do a month. You give people a month, you give them 2 months, they're gonna take that long to do it.
We don't
Unless
make
by
the
statute.
determination of the open enrollment
Okay,
period.
well then we'll let them have November to December,
Who?
the retirees.
We don't get to make the decision,
Why is that?
because we're not self-insured.
No, open enrollment has nothing to do with being self-insured.
Lisa, who sets the open enrollment? Am I wrong on
PEBA
that?
sets the open enrollment.
Yeah,
So, okay.
that is,
So you're saying
that's not
the
set by
state-
us.
The state sets open enrollment,
Yeah.
okay.
I see where you're going. Maybe we should allow, well, we don't even
State,
have, we don't
state
even have the
sets the open
information
enrollment.
right here.
I mean, you know.
It's not even coming out till right here.
Yeah.
You know, like I said, I saw this on the agenda, I've thought about this since we got those complaints. And this was just my suggestion over here, and I don't wanna get ahead of everybody, but again, July 1, we send them a notification, like, for instance, the 18% increase. We could have got pretty close to what that would have been. We let them know there's a significant increase coming of this much, we can give them all the facts we have, and tell them, we expect, you know, your rates to increase approximately this much. Give them heads up then, give them heads up going into open enrollment, again, another letter, another reminder. And then, the letter that they traditionally, the only letter we've gotten after open enrollment, we send that out with the final numbers.
So I would recommend that, I mean, over communication under this is fine. I would go communication in July, September, and
They're not gonna
then
get one every month.
every month, right, prior up
They're gonna get
to,
one every month?
what's that?
We're gonna send them a letter every month?
No, he's saying 3, he's saying
Three,
3.
no, I'm saying three, I'm saying July, September, and October.
July, September.
September, and October.
In
November,
October.
November.
They're gonna get the
November,
packet in October.
No, I'm saying beginning of July, September, and October, the beginning, and then one in November.
Yeah.
Okay, spoon feed people.
That's okay.
Well, if they're complaining about
That's okay.
notifications, I get what you're saying, but if, I
Hey.
don't think it's that.
Yeah,
This is
listen,
important for
with-
fixed
in
income.
self-reflecting on how we notified them,
Yeah.
we gotta be honest, we could have done a better job last year. We
So,
could
so
have.
Yeah.
are the
And so
three
we're
of
gonna
us
give
in
that heads up in
agreement
July.
that communication would be July, September, November?
October.
When they get the packet in
After the
October.
open enrollment.
We're not
Well,
gonna have
when-
the final number until November.
After we get the results back from the actuarial,
Then they crunch
we'll
the
turn
numbers.
that number around right away back to the retirees.
So
And I
when
do-
Wouldn't you give a notification right at the beginning of open enrollment?
You
Just
should.
don't
As a
believe it.
reminder?
That's the September one.
Well, they'll get the notice of open enrollment, but we're talking about the notice of premium. They're gonna get a notice on open enrollment for October.
Okay.
So this does make sense.
Or they get that directly from FEMA.
They do, okay.
So this
All right.
does make
Okay,
sense.
all right, that
July,
makes sense.
September, November. Does
Okay.
anybody disagree with that?
No, we're good.
All right, well, that conversation.
As long as staff knows, they can send it out.
Yeah.
This is another piece of mail.
All right, now, we're gonna talk about cost. And so here's the thing about this conversation, and Lisa, I know you're not really participating in the conversation, but it's in our best interest to understand that.
Yeah, so you tell.
It's in our best interest to understand that what we're about to talk about can be very sensitive. So, and we're gonna need to talk through this to get to the other side of this to come up with some solutions. So while we're talking about this, we're all gonna say something and somebody else is gonna think that's the craziest thing I've ever heard of, but we're gonna have to have this type of conversation to get to a solution, right? So, let's all be sensitive to what we're talking about, but let's don't not put anything on the table for consideration. That's how we're gonna get to something that's logical, right? Okay, just like we just did right there. That was an easy one, that one's done. So step one's done. The next one is probably gonna take us 2 or 3 meetings, in my opinion, to get through. So, I'm not gonna assume that anybody understands this. So what I wanna do is, Kevin, I need you to be to the point and real clear in explaining, or either somebody explain this so that we're all together on what we have in our hand. Are y'all okay with that? Tom,
Mhm.
is that valuable?
Mhm.
Okay? Bump, you
Yeah.
good? All right. Okay? If you'll explain it, and then we're gonna ask you questions, okay? So we've got pre-retiree and pre-65 and post-65. Those are the 2 categories we're talking about.
Okay,
And just for the heck of it, how many pre-65s do we have? 300 or 400, roughly?
pre-65, it's about 170. Post-65, this was 230, Lisa? Something like that, approximately. These are approximate numbers.
Counted them earlier up with that.
260 and 175. Oh, that's better than we thought. That's good. It's a smaller problem, or smaller conversation than what I thought, not problem.
And there's about 300 employees that, the way the plan's currently structured, are still working in the county, they're eligible. And I'll remind everybody, when this.
Okay, say that again.
There are about 300 employees that are
Oh.
working for the county right now that would be eligible to receive this when they retire. Now, I'm gonna point out to everybody, when county last made changes to this, they drew a line in the sand on the timetable and said, if you came to work here before this date, you're gonna get it. If you came in after this date, sorry, you don't get it.
Mhm.
And, you know, I'll tell you now, I've already got my recommendations as what I would do to cut costs of this plan. It'd be the post-65, and it'd be the current employees, and I would stop insuring children and spouses as well, just the employees.
So what, so how many people right now, oh, you said 300 is still with us that's currently working?
Approximately.
Who's gonna be eligible to get the same
Under the
benefit?
current plan, yes, sir.
Mhm. So when it's, so right now, how many retirees are no longer working for the county get?
About 400.
About 400?
You said 260 though. You're
We have about
including.
270 that are over 65,
Right.
about 130 that are under.
260 and 175. 260 that are over 65 and 175 that are,
No, I think it's about 130. What's the exact number, Lisa? You send
Actually, I
it?
think when we counted, it was ended up being about 122 pre-65 retirees and about 250 post-65. So that's approximate, but that's pretty close.
okay,
Round
for
numbers,
clarification
round
then, what was 175 and 260 earlier?
It's
Just,
not 175.
okay, well, that's fine, don't worry about it. It's
That's what I wrote.
122 and it's 250.
Yeah,
You got that?
Okay, 122 and 250. Okay, yeah.
122 would be how many are
Pre.
Pre, and then
pre-65
250 the, okay.
post?
Yeah, cause I wrote
That's a
175.
approximately, those aren't precise.
Yeah.
Okay.
Okay.
We
Okay.
got it.
So, let me ask, we have 3 categories here. Do you all wanna talk about all 3, or you wanna hammer one first and then go to the next 2?
Well, I think if we're gonna spread this out over a meeting or 2, let's just take one at a time.
That's probably a
You
good
really
idea.
are, you know.
All right, y'all wanna try to talk through 65 and older,
Mhm.
retired and not 65 yet, or,
Let's go 65 and over.
Yeah, 65 and older. Well, when we say 65 and older, those are ones that are no longer working for the company.
Correct.
I mean, for the
County.
I think it's like a sticky note.
Yeah,
You can put it to the wall.
yeah,
Go.
I ripped it. Alright. Okay, let me share this real quick, because I think this is important to our conversation, if you don't mind, Kevin. So, let's forget that we offer anything. You gotta listen.
I'm listening, man, go ahead, go ahead. I'm listening.
Let's
Tom,
pretend
pay
like.
attention.
Yeah, pay attention.
Do what?
That was
Tom,
what I
pay
looked at. Why is
attention.
it so quiet? Jesus, go ahead, I'm listening, man.
Teachers watching. All right, Medicare. I want to educate you on something first. Let's assume that we don't offer anything to somebody when they turn 65. What's available to somebody when they turn 65? Or if they work until they're 70 and then they go on Medicare. Let's talk about that. Medicare Part A is what we call your inpatient benefit to Medicare, inpatient. That costs you nothing because while you worked, you paid for that. That came out of your paycheck. Part B to Medicare is your outpatient benefit to Medicare. And this is what we call, this one is means tested. Means that it depends on your income before you retired, what that's gonna be. But for the most part, let's just call it for the heck of it, because it could be an increase coming up. It's $140 a month out of your, so somebody that turns 65, they're gonna pay this $140 a month for their outpatient benefit to Medicare, either out of their Social Security check, or they're gonna get billed for it quarterly.
Right.
All right? Now, Part A and Part B has deductibles and gaps. So traditionally what people do is they buy a Medicare supplement. That's exactly right.
Mm-hmm.
Like your parents are probably on, my mom's on a Medicare supplement. Whoops.
I used to sell them that again.
Really? So the Medicare supplement theoretically insures the gaps, depending on your age. If you had Plan F, it covered most of it. Now F's gone away, unless you had it grandfathered in. But the Medicare supplement wraps around Part A and Part B. And right when you come out of the gate at age 65, I'm just rounding numbers here, let's just say it costs $160 a month. And then the federal government says you have to have a Part D policy, D for drugs. Let's just say that costs $50 a month. So coming out of the gate for a 65-year-old, it's about $350 a month. That's if you don't have anything. You don't have a retiree health insurance coverage. You're not working.
But is that covering but there's still deductible, isn't there, on that?
Not really. Now that with Plan F gone away, you got G and H.
Okay.
There are some small out of pockets, and you got your donut hole, and you got co-pays
Right.
on prescriptions.
Right.
So yeah, there is a little bit of out of pocket, but not like a.
No, like it used to be.
Yeah.
Okay.
So basically, the premium's $350, and I think this is what we have to focus on is cost, not
Mhm.
necessarily plan design, right?
Mm-hmm.
All right, so you got $350 of premiums. That all makes sense? Part A is your inpatient, Part B is your outpatient. You do not have to buy a Medicare supplement. You can self-insure this if you want to, but you do have to have this by law. Right?
Okay.
And if so, somebody picks up all this $350 a month.
So
I'll
what,
just-
so if I'm 66, not working, I pay $350, I get all of that.
So you understand why I'm going over this
But-
with you now, don't you?
Yeah.
Okay.
When I'm 70, what do I pay?
Good question. So this Part B comes out of Social Security. It's going to change, right? It's gone up $20 in the last 3 or 4 years. I don't even know what it have to ask. At least some officer writes this coverage. The supplement though is going to tick up, like you're saying, Kevin. So like at age 70, it's probably going to be 180, 190.
So it's adjusted for age.
And I can get you a
Yeah.
schedule to help you think through solutions, right? When we get to solutions, yeah, it's gonna go up. So 70 is probably gonna be 180, 190. It's gonna
And
gradually
that's
go up.
one of the things with the retirees, when they get 65 and they get this, they think, oh, everything's covered. And then, cause like if you look at ours, it happens to be $350 that we're kicking in for the post 65, but as they get older, those costs go up. And again, what the county's doing right now, we're basically paying that flat fee forever for those people. Even again, post 65.
Okay, I think this is important to understand because as we think through options, when we get to that, probably our next meeting, when we get to options, this is gonna be important to think about. Because they do have an option. Let's just say, just for the heck of it, let's say this is, let's do it right here. So let's just say age 65, it's $350. And I'm gonna tell you something else in a second that could change this. And now these are not, don't hold me to these numbers, but let's just say for the heck of it, this goes to $425 a month. Let's say this goes to, just for the heck of it, $475, and this one goes to $525, okay? So obviously, the older you get, the more expensive it's gonna get, right? All right, now, somebody could take a Medicare Advantage policy. You ever heard of that? Medicare Advantage is a policy that takes all this and wraps it into one policy, and the premium could be virtually nothing, or it could be $100 a month. So a lot of seniors here, I mean, this guy showed me something that's $350 a month. I can do all this for $100 a month? I think I'll do that. Sounds good until you start using your insurance, and you get, because the max out of pockets, don't quote me on this, as Lisa writes this for us, I think it's $8,000 some odd dollars is the max out of pocket. But now you could be exposed to $8,000 a year, but once you have a medical issue, you're stuck on that. So I think we not even think about a Medicare Advantage as we're talking. We think about traditional, the way most people pick up their coverage after they retire, right? All right. So keep in mind, and we can, if this is important to Kevin, we can get some actual numbers based on today. It's going to change a year from now, but we could come up with actual prices depending on age brackets.
So Kevin, let me ask you real quick. So right now, you're currently paying the $350, roughly $350?
Nope. Let's go to this sheet and talk about
Okay.
Look at this sheet here. Look at the column in the middle right there, okay? This is what we're paying for every retiree. And so,
So he's saying he's paying $840.64 is the total premium with a 12% increase, right?
what the
Total
retiree
premium.
pays is the difference between that 840 and the 675. You see that? The next
Yeah.
column over, okay? So under the 2023 retiree, that's the cost of the premium. What York County contributes is the next column over there, 675,
Okay.
$1350 for retiring spouse, $1450 for retiring family. Some of our retirees, their retirement check is not $1450. We're paying them more in insurance subsidy than their checks are.
That's amazing.
It is, and it is, there's a reason we have a $30 million liability on this
Yeah.
and growing. So that's what we're contributing there. When you get that, the difference, the cost on the post 65 is not as severe, but honestly.
So hold on a second. I want to make sure we're all together.
So let
So
me
you
ask
follow what he said here. He said the
Yeah.
premium's $840. York County's contribution is $675, and the employee picks up the difference, which is $165.64. Are we all together on that?
So the question I have is on this, for 65 and older, because the Medigap program I sold was again, it was a gap filler similar to what we talked about here. But when it came to families of members that are 65 and older, the family policy under Medicare, do they even,
You buy individual policies.
you buy individual policies, there's no family, okay. I
But
didn't think so.
theoretically,
We're giving $700 for the post 65.
Yeah.
We got spouse, children, or family. We're contributing that much towards theirs.
$675.
No, 700.
Where
Look
you-
down below. What? Option 2, go across there. Under the post 65.
Oh, you're saying for employee
Post
spouse, employee
65.
child, or full family
Yeah.
coverage.
I mean, and I don't know of another county that offers anything like this at all. It's just, it's a luxury that honestly the taxpayers are having to foot the bill for. And there's just a small group of people that are getting this. And again, you know, I have my recommendation, I think I've already put them out there to y'all, but we'll go through this whole process, y'all can understand everything. Y'all can only conclude to council what we do with this.
But I just, it's still, I mean, so you're paying them $1,450 for people, somebody that's over 65 years.
No, under 65, that's under 65.
It says-
Oh, pre-65.
That's like you get the guy that retired in the old system 40-something years old. We've got some of those that retire in their 40s. And
Okay,
they-
let's
they-
back up, because we're only gonna talk about post 65 right now, then we're gonna go to pre 65, okay?
So,
Okay, okay, yeah, I thought we were on.
Let's stick with post 65.
so when it comes to contributing $1,450 a month to a retiree and his family,
Mhm.
how many people on that system?
The number, Lisa, it's approximately, how many would you think, Lisa? Don't be precise.
Because when it comes to family,
Did-
why are we?
Right.
I mean, this blows my mind. That we're putting in. We have an option that will insure a kid. My son, and he's going to be 45 when
He
I'm.
wouldn't even qualify under family policy, my kids.
I know, like I said, I've got my opinions about the plan we're offering over here, but I think Watts has got a process he wants to go through so y'all can understand step by step each piece of it. But y'all are hitting on the same topic.
Well, let's go back to what you just said. When they turn 26,
Yeah, when
They come
can't
off.
be
They're coming
they
off.
gotta
Yeah,
be
they
off
don't
the
stay
policy.
on.
Believe it or not,
past
there's some
26.
people that are a little older in life that have younger children too.
yeah, right. Yep.
Okay,
Yeah.
but so
Well,
here's the
that's
thing.
true.
So
I
what's
gotta
the
do that. I'll
cutoff?
still have some
So-
that could be on there.
If
What
they're
am I
under,
saying?
if they're under the age of 26, yeah.
Right.
But first thing I thought of, man,
Yeah,
Trey's
they're
gonna
not-
be
they're not
Trey's gonna be
covered.
37. I have no right to be insuring Trey, and Trey's 37 years
He
old.
can't.
He can't. So as long as he's under the age of 26.
That's correct.
Yeah.
If
You know,
if that's my son, not my
We're
stepson.
offering up stuff to, you know, this is a Cadillac of a plan right now we have.
Mhm.
That's, again, I'm speaking on my behalf. And that's why we have a $30 million liability around this, that we're putting $600,000 a year in the budget towards this liability, in addition to paying this money
Okay.
out. And that liability is just continuing to grow. So it's become like a financial weight around our waist. And again, I think Watts is gonna go through each category so y'all understand it, and y'all can come up with your recommendation to council. I'll give you my 2 cents, but it's gonna be y'all's recommendation to council is what to change in this.
So, let me ask a quick question on this. What are we seeing in the other counties? What is the trend?
Back in the early 2010s, 2012, 14, something like that, when Gatsby, I can't remember the Gatsby came up, we had to start recording this liability, governments started slashing these plans. Everywhere they started slashing them. Rock Hills, I look at Rock Hills today, Rock Hills is single-digit $1 million worth of liabilities on this. I wanna say like 6 or 7. I looked at their financial data, look at that number. I don't know of any county out there that's got a liability of our size on this, because we're offering a plan. I don't think anybody else, I don't wanna be definitive, but we're offering one heck of a plan to our retirees, and it is very, very expensive to the entire tax base of the county.
What did the city of Rock Hill do to reduce the number of retirees on their health insurance coverage? No?
I know.
That would have been done almost 10 years ago, but I mean, that's, you know, and Watts, you've helped Chester County, I don't know if you want to share this with the group, reduce their liability years ago as well.
They got out of it completely.
Yeah, I mean, and that's, you can just slash it for everybody, or, you know, or you can offer to buy some people out. I think there's a benefit to have this for the employees that are currently retired up to 65. I think that's sort of fair and a good thing to do for the employees only. But, you know, right now, just my 2 cents, we've got a Cadillac of a plan where the taxpayers pay for a small group of people.
We took a huge step when Jim Baker was here. We actually said any new hirees coming on board would not even be eligible for.
That was under Shanahan, I believe.
No, we could get on the
Baker was
bill.
still here when he did
No,
it?
we did it on
Baker,
Jim Baker.
okay. Now, you have a funny story
Now-
about
now-
that?
now-
You know
now-
how that came to be? In that room over there before it got remodeled, when I first met Brett, I was looking at the county's financials and I saw there was liability. And I asked Britt, I said, I don't know, you might be one of those East Coast or West Coast real liberals who don't mind kicking the can for somebody else. Because that's how that cut came to be
Yeah, it was-
back then under
now,
Baker.
where would we
I
be-
broke it down to Brett.
Where would we be on a liability standpoint had we not put that in?
Well, right now, you're close to, we're at 30 million, right at 30 million. This is just a guess, you're gonna be probably somewhere between 70 to 80 would be my guess.
So that was
That was a smart thing to do, but I just don't think y'all cut enough then at the time.
well, I don't think this kind of topic or conversation was around it for people that stayed on the plan and kids on the plan and post 65. But
Yeah, I
Let
mean,
me
that
share,
was supposed-
let me share with you something that changed by federal law. That might be something that we could consider. and that is that, so how many retirees do you, the 65 and older that worked for us, how many of them, do you know how many of them have spouses covered?
They're currently still working,
No,
Retired.
retired.
because we're just talking about post 65 retired.
Post 65, we've got about 174 single on the plan and about 74 that's carrying spouse.
74 is carrying spouse.
Do you charge extra when you're carrying the spouse if they can have access
Well,
to insurance?
that's exactly what I'm getting ready to say.
The subsidy, if you look at the column down below, the contribution, is $300 for the retiree only. It doubles when you got a spouse. So we give them an extra $350 towards their bill. Their bill, if you look at the premium in that next column over there, Tom, it's $500 for the single,
Mhm.
and then with spouse, it's $1,057.
So let
So
me
they-
just pick up on what he was saying though. What Tom was asking
Yeah.
is that in a law passed that said, as an employer, if your spouse works somewhere else and is offered group health insurance coverage, doesn't
Offered.
matter what offered,
Offered.
doesn't
Offered.
matter what they contribute,
Mhm.
they're not eligible for coverage here.
Well, they would, well, no, but they,
No, they're not eligible.
well,
for
they
coverage
would be,
here.
they could
You
because.
could make stipulations, but that is the hard rule. You can soften it, but that's the hard rule.
Okay, that's
If you want
fine,
to
if
adopt
you can
that.
soften, but let me just, in our program, like at AT&T, for example, I'll spend an extra, I can add my wife into our family plan, right? But it's additional $150 on top of the existing premium.
Correct. It's a
So-
disincentive for you to do it.
It's a disincentive.
Yeah.
So my point was that, I just wanna throw that out there because if it makes sense from that opportunity to offset some of the cost by, maybe that's a way of another revenue stream, I'm just throwing the idea out.
Reducing liability, use that term.
Reducing liability.
It's called a spousal affidavit. So you can have a spouse.
FEMA has not put that in as a requirement in their program.
Yeah,
They
well, it doesn't
have
have
not-
to be. We have the
Okay.
option that we can do it unless they tell you you can't. So what I'm saying is that,
If we're gonna carry spouses.
Right.
Make them pay a premium on it.
well, you could do that,
Right.
or you could say, if you're, because look here, it doesn't make sense for somebody to double cover.
Right.
When you're double covering, what are you covering? You're covering your deductible and you're out of pocket. So you probably are spending more in premium, somebody's premium,
Yeah.
the county's premium,
If you're
than
double
you
covered.
should. So hear what I'm
I don't
saying?
think we can make that decision. We're stuck with the decision PEBA makes, Lisa, correct?
Well, we need to look into that. We need to confirm this.
Do-
So the
It may be
question-
something that we can do for retirees but not actives.
Well, let's-
because every
let's-
county
let's
can
see.
determine their own
Now, let me ask this
process for retirees.
So on the spousal affidavit, to go back to what you're saying, what we're asking is we need clarification if we can apply spousal affidavit to 65 and older, pre-65 not working, and working but eligible for retirement. Can we do it for all three categories? And once we have the answer to that, this could be a fairly creative move.
You might could do it for the first two, but the ones that are covered actively full-time, even though they're
Mhm.
retired and continuing to work, I don't think we could do it with them right now.
Well, we'll confirm.
Let's confirm.
Let's
Yeah.
confirm in writing with PEBA.
So do we even ask,
No,
are you eligible?
no.
And that's what we're getting to.
Yeah, that's
That's what we're
what's
getting to.
alluded
Right.
To find out, hey, is your spouse eligible for any other coverage, whether it's through her job or whether it's through Medicare? Because a spouse
You're
could
right.
be older.
TRICARE, Medicare
Yeah.
could apply. Individual
Yeah.
health insurance coverage historically is not applied.
Yeah.
We'll talk about, that's separate, and we'll talk about that in a minute too.
So just to educate me, does PIVA offer a Medigap program, a GAP program?
PIVA just offers a Medicare supplement program.
They do. But it's
Well,
related to
Which picks up
Medicare.
20%.
Well, this is a
Okay.
good question. So
Right.
piggyback on what you're asking,
Mhm.
because I don't want to assume this. Do our retirees have the same health insurance coverage that's offered to us?
If they are pre-65, yes, sir.
Post 65, they're offered a Medicare gap.
65, they are offered a Medicare supplement through the state or through this other company that we work with,
Mhm.
Plan Benefit Services,
Mm-hmm.
that will offer
So
them
what-
a private sub.
So what is the differential in cost that so if we're funding, do you know what the cost to them of that of the GAP? Like how much they would pay if they got that Medigap?
500
$500 a month
per single.
for a single, okay. Okay.
Wow.
That's a lot.
That's a lot.
That's a lot of money.
Even somebody that's 65 would pay $500?
On state,
Yeah.
Wow, that's, that's.
Pre-65,
no, post-65.
pro-65.
65 and older.
That's a
But
lot.
they also have prescription coverage through the state rather than having to cover it through Medicare.
Or through a
Oh,
Part
so
D
they're gonna
policy.
be, so their 160, they're paying right there would be covered basically for the,
Yeah.
so the differential would be. Okay.
Well, that's
Yeah, but if they have, but the thing about it though is if they, could they still have the Advantage, Medicare Advantage and get the supplement? No,
The state doesn't offer that.
it doesn't, okay, alright. So they
And
can't,
neither does the company that we've been working with.
Right, so
They
you
offer
can't-
just at MedSup.
so, okay. Okay.
We don't know how many of the 70 some odd spouses that are covered, we don't know how many of those are pre-65, do we?
Not right, no.
That'd be important to know too.
You writing these notes?
And the reason why that's important is because, again, if we can in fact put a spousal affidavit in place, they're still picking up coverage through where they're working. If they're 60 years old and they're working at wherever and they're paying 80% of the premium, there's no need in us subsidizing our retired employees' spouse's
spouses.
coverage. And if the spouse ever loses coverage, at 63 they lost their coverage, I mean, we can make a provision that lets them come back on until they're 65 or something like that. We can cross it, we can think through that too, right? You're not permanently, you could be. And this is where we gotta think through. You gotta put yourselves in the shoes of the retiree and think through logically our options, right?
That is the guideline we use now with PB, is that if they lose coverage, then we treat the retirees very much like we do the actives. They just have to provide proof they lost it within.
There we
30
go.
And you
days.
can-
And that would be
You
consistent.
can enroll during the year, but again, if we're gonna have it eligible, to continue to make it eligible for spouse and children.
Yeah, well, it'd be qualifying event based, and you're saying whether we're gonna keep doing it or not. I hear what you're saying. But what we're doing is we're trying to create options that aren't hurting the retiree. There could be a difference in cost, but, and we gotta make wise decisions with taxpayers' money.
I just find it amazing that if you're over 65 and we're still giving them a supplement there that would contribute towards their kids. I know you and I are a little bit of an exception, you know what I mean? But that is unique. Because most of the time,
Yeah.
you would expect them being over 26 years old by the time they hit
Yeah.
that.
More and more are, though, people having kids later.
All right, so from a cost perspective,
I had them early, Emily.
you're a late bloomer.
Hey, look.
All right, so from a cost perspective for post 65, what you're looking at, does it make sense? Do you have questions for Kevin? It all makes sense, right? Basically, let's just make sure we're right here. Post 65, they're paying $165.64 a month for single, $474 for spouse, $417 for employee child, and $683 for full family. Is that correct?
Yes.
Okay. Are we together on that?
They just quoted the ones for pre
Huh?
That says free.
Yeah, that's pre.
That's pre, we're talking.
The
about-
ones, the top is above, I'm sorry, top is
Free.
under
Pre.
65, the bottom, the 350 and the 700
Right,
is
that's.
post.
Oh, I had them
looking at the
backwards.
bottom.
I
I'm
had
sorry,
them
what?
backwards.
I'm sorry, misunderstood what you're saying, I'm sorry.
Post 65,
So it should be
65,
350
yeah.
and 700.
That's right. Well, actually it'd be 150, 357, 69, and 625. Y'all see that right here? Right? Right
No,
down
that's the
here.
retiree's cost.
That's the cost.
That's what they're paying, that's the
Yeah,
difference.
that's what they're paying, yeah.
But our contribution is.
Because our
Flat.
thought process, in my opinion, we can look at it from the county's perspective, or we look at it from the employees, retirees' perspective, and I think we gotta look at it from the retirees' perspective, so we try to make good decisions based on that,
Mhm.
in my opinion.
And
But I'm just one of
all
three.
y'all notice, again, that the bottom part down there, this is why the 150.38 that Watts referenced, if you look to the left, it's 150.38. There was no increase in cost for those. So they didn't have an increase in their out-of-pocket that they were paying for health insurance last year.
Yeah.
All right, and when you look up above, and you see the 7557?
Oh, yeah, I see
And then
what
the
you're
one
doing now.
sixty-five,
Yeah.
that's the difference in the check that they had to write, okay?
Yeah, that's the 165 is what the pre-65 person paid out.
Correct.
All right, so let's stop for a second and let's ask, are there any questions about post-65? Can you think of anything that would help you just think through this when you leave here tonight? Anything that helps you think through the post-65s?
The only question, and this is, like, I'm gonna throw all questions out there. But when we look at in-state residents as opposed to, say, people that move out of state, they move from here to Florida, that we're working for the county. Most of the time, they're probably gonna be obviously on Advantage Plan or Medicaid or whatever, so it really doesn't really matter much.
Medicare.
Medicare, yeah. But I'm just thinking, is there a variable between in-state retirees and out-of-state retirees? I guess that would be my question.
Not from us, no. Lisa, I mean, yeah, there's,
Okay.
whether the retiree goes to Alaska, Maine, or Florida, it's still the same.
Yeah, I would assume so. I wanna ask, you just kinda,
You want to incentivize people to stay in the state,
I wanna keep people.
and we don't offer anybody to leave the state.
That's right, don't leave. That's right. No, I just wanna, just thinking about it, just, cause
Yeah.
I didn't know if there was some variable there.
No, 'cause
Okay.
there's- yeah.
All right.
Just looking at this, it doesn't seem logical that somebody would be husband and wife over 65 would not want to jump on Medicare and pay those rates versus sticking with us. Because even if we're contributing to it, they're still coming out of pocket probably more than if they were to jump on the Medicare plans.
Well, but they have both. They have
They
the
get to
Medicare
double dip,
coverages as
basically.
well as the
Yeah.
Well,
supplemental.
that's why, again, part of my logic behind you get 65, you're on your own.
Explain double dipping.
What she,
Yeah,
Lisa just.
say it again,
Well, I mean,
please.
they actually have both coverages. They have the Medicare coverages as well as the
That
Med
goes to your
Sup
point earlier, was.
and the prescription coverage. And that's what they're paying, their Medicare as well as this premium for the supplement.
Well, they wouldn't be double dipping. Let's clarify. They're not double dipping if I'm understanding what you're saying. You're saying they have what's provided to them, Medicare Part A and Medicare Part B, correct? From the government. And then they have a supplement through us,
That costs a heck of a lot more.
right?
Yeah,
they have a
it's
supplement.
costing more.
It costs more.
But let me
Costs a heck
explain
of a lot
to you,
more
the
at that
supplement,
point.
this is what I was explaining over here. The supplement, the Medicare supplement, they're paying, or we're paying what, you said it's $500 a month, we're paying for it?
Well, they can
Yeah.
be getting it
Way
for
too much.
160
Well, we're
there.
paying the $350, the cost is
$500,
Yeah,
We're paying for it, yeah.
yeah.
yeah. And at 65, a Medicare supplement in the open market's about $160.
But
So they're
there's-
paying
it's
150.
costing us
But
$500.
let's go back to double dipping,
Yeah.
right? They're gonna make sure you're square on this. The supplement, you buy a supplement or you have a supplement to wrap around
Yeah.
Part A and Part B to cover the gaps of A and B. So it's not, you're not double dipping.
Well, if they're
Unless
not,
I'm missing something.
if
what
they're
you're
not,
saying.
well, and that's what Lisa, so why would somebody do that then, Lisa? What's their advantage? How does that put more money in their pockets?
You're talking about why do they buy a
No,
supplement?
no. Why are they on our plan and Medicare?
because.
Because we have two options post 65.
Okay, hold on, let me answer that question.
Well,
Medicare Part A, this is Medicare Part A, which is your inpatient benefit to Medicare. Part A. Medicare Part B is your outpatient benefit. So the government offers you A at no charge, because you paid into it during your working years. And Part B is means tested, so if you make $300,000 a year, it's gonna cost you $400 a month probably. So Part B of Medicare, A and B. But these have deductibles and limitations and coverages. So virtually everybody buys a Medicare supplement to wrap around A and B to theoretically give you 100% coverage except
Right.
for prescription drugs.
Now, I get that. Now, Lisa, the two choices we have for post 65, okay? Explain those two options.
That's good,
One of
we
them
need to
costs us
understand
more
that.
money. One of them costs us more money, and there's a reason
costs
it costs us more money.
Okay, if they stay on the state Medicare supplement,
Okay,
That's the cost we were discussing. We've also got a company that works with us for folks when they hit 65, that offers to work with them to see if they can benefit from a private sub through Blue Cross Blue Shield that they sell. And if the person's around 65, premium on that's gonna end up being $100 and something a month to start. That's
So
gonna keep
wait a
going
minute.
up with their age.
then why are we even given an option?
Wait, that's what I'm saying.
The reason we.
Well, that's not double dipping, that's an option, but I don't
But
understand. Help,
there's a
what's,
reason they're doing that option though. There's
what's
gotta
the
be.
what's the $500 plan though? What's the difference between the Medicare supplement through the state and
It's the state supplement and it's the Express Scripts prescription coverage
Part D, yeah?
and it has different costs with the
Okay.
state prescription than just plain.
Can
old
you do us a
Medicare
favor?
script.
We need to see the plan design for the $500 plan and the 300, or the 100, I know what the 100 and something, but we all need to see this.
There's some
So-
advantage.
Well, let.
Yeah,
can I
we need to
explain?
read it.
Can I explain one more thing? The
Yes,
gentleman
ma'am.
that we work with, through Plan Benefit Services.
Right.
When we have a retiree that hits 65, or either they are 65 when they retire, then he goes through what types of medications they are currently on.
Right.
And tries to assist them in figuring out if he can get them a decent Medicare plan to go along with the private Blue Cross supplement. If he can, then he helps them enroll in that private Blue Cross supplement and then prescription coverage through Medicaid.
Is that something in addition to Part D?
That's Part D. Well, I think what you're
But is it in
describing.
addition to Part B to help further reduce
D
the
or
cost?
D?
D, which is prescriptions, right?
D. I think what he's getting
It's
what
different
medications, so anybody that's helping somebody that's 65 or older figure out what they're doing with Part D, the prescription benefit, you would have to know their medications because Silver Scripts, there's all kind of companies out there, and their price will vary on what you're taking. So when you have, I hate to get
So
off
that
the tangent.
$50 you put up there, Watts.
Yeah, that's
just a guesstimation. Okay.
that is
Okay.
that's probably a above average cost for Part D.
Okay, but I guess, and we don't.
And that's the only
I don't think we
thing-
have it all right now, but I really want to understand, because when I say double dipping, they're getting some of their deductibles or something else paid extra, and it costs us more money to do it. They've got two options. One costs us more than the other.
Yeah, and I don't understand the $500. I'd like to understand that because I don't understand why you would have something better than traditional Medicare. That doesn't make any
Right.
sense. And most everybody's taking the $500, huh?
No, not really. When they find out they're gonna have no premium to start with at age 65, they like that idea.
Oh, that's a Medicare Advantage
But then,
policy.
then as
No,
the
it's not.
age,
It's still a Medicare sub.
then as the
Yeah, it
age
is.
goes
It is.
up.
Medicare supplement Medicare Advantage is a Medicare
The
supplement.
biggest majority of the ones that have stayed on state health plan are ones that when he did their prescriptions, he realized they had really expensive prescriptions that they could get through state health plan more reasonably than they could
On a private.
So-
through Medicare. And once they knew that, then they made the determination, am I willing to pay a higher premium per month to have the state supplement and the Express Scripts rather than go to this other plan and then have to pay much more out of pocket for my drugs.
I got a question for you guys.
Yeah.
What do you think about having the gentleman from Plan Administrators zoom in with us at our next meeting and explain the post 65 two plans to make sure we understand what we're talking about? Not that you're not explaining it, but we can see it. What do you think about that?
We're gonna meet anyway.
Yeah.
4:30, it'd take 30 minutes, and it
Mhm.
would probably give you some valid information so you can make a strong, informed decision
Mhm.
ultimately on what we should do.
Yeah, no, I'm good with that. But I do have a question though, the stacking though, do you see where, they're stacking the $500, supplemental plan with the Advantage plan together? Okay. You don't see that, okay.
I know one of the regular options we were offered at Bowater, the company put so much into like a health spending account, blah, blah, blah.
Right.
Would we be, I would like to see that be some kind of option if we're putting X number of dollars in an account
Yeah.
for these post 65.
That's a good
That's
idea.
far less than what we're paying out in the premiums. And that money goes in that
Yeah.
spending account, regardless of whether they use it this year, next year, whatever.
That's a great
You
idea.
don't even realize how
Putting the funds in
creative.
HRA.
That,
Yeah.
that HSA.
You don't even realize how creative that was, what you just said.
Mhm.
And,
Well,
when we
I'm
ultimately get
smarter than I
to,
look.
when we ultimately get to solutions, that is definitely something to
Yeah,
consider.
I second that.
'Cause we-
Mhm.
Not
It's-
as cheap as just.
No, it's not as cheap as just.
Well,
cutting.
there's, yeah, that is.
And I got
that's a
news
good
for you.
idea.
If we're at that
That is a
option,
great
when we
idea.
get to it, you get to present it and we get to listen.
So right now, you don't contribute to an HSA.
No, no.
See, that's a great idea, because that money.
Can't have a health and savings account unless you're covered under a qualified high deductible health plan. So 65 and overs can't have one. They can spend what they have in it, but they can't
They
fund
can't,
it.
you can't have one of.
No, you have to have a
Like
qualified
when
high deductible
we're
health
at the
plan.
firm, we had a high deductible, and so you set that up to set aside your deductible every year.
Yeah.
And then that's what you spend.
And keep in mind, when you go on Medicare, you don't have any more deductibles or out of pockets really. So you don't want to recreate that, not unless we're looking to really,
Well, but you do have, we talked about the wrap, I mean, there is some additional, cost.
with prescriptions.
Yeah,
Yeah, copays.
but I mean, if it did, I didn't realize you couldn't, it has to be qualified, I mean,
Well, that's a good thought, but you can't.
no, but it, yeah.
Well, and the one thing that they are allowed to do, the post-65 retirees, if, say their Blue Cross Blue Shield private sub doesn't cost them but $120 a month. Their prescription coverage through Medicare might cost them $20 a month. We're putting $350 in that RHRA for them each month. If the premiums don't come back out equal to that $350, then they've got some funds left in that RHRA that they can turn around and file against, much like a medical spending account.
Oh,
Which is
really?
what you're saying.
And
Oh,
they can
okay.
pay for dentures, they can pay for glasses, they can, you know, things that the insurance.
So it's a way to do it.
Yeah.
It's a way to do.
You could carve that out, sure.
Yeah.
Yeah, so does it roll, would it roll year to year if it, can it
Yes.
roll to the next year? Okay,
Do you have an accounting on how much?
what's that?
Go ahead, Watson.
Well, this is good. Do you have an accounting on, and I was gonna ask a question about that. What did you say? I saw it somewhere, but I don't see it now. What is it called? A RHRA? What is it called? RHRA?
Retiree health reimbursement account.
Okay, RHRA,
the
which is
middle
what you
column.
were describing, by the way. But,
Yeah.
so,
It's York County monthly.
there we go, RHRA. Now, let me ask a question. Of those, that's offered to everybody pre and post? Pre-65 and post-65?
That meet the eligibility requirements. If they don't meet the eligibility requirements, they don't get any.
What would cause them not to meet the eligibility requirement?
If, like, when they, 2015, when the county made the change, like Britt missed it, okay? If you started the county after a certain date, even though you might have been working there for several years, you were not eligible to get it. And that was the
Who
line
crafted
in
that
the sand
language?
was drawn back then.
Who crafted that language? Me and Britt started at the same time. I would have never supported that. Michael, do you have something to do with that?
Michael
Okay.
is in the category that he is eligible.
Oh,
So he's on
okay.
the other side of the line.
If you're hired after
But-
August 31st of 2011, you have no retiree benefit.
After August 31st, 2011.
Yeah.
I started
So
January
there-
the 1st. I started January 1st, 2011.
Well, no, you still have to have, yeah.
No,
I gotta have what?
certain number of years. Britt got out too early.
He got out?
So it's the date in a years, is that it, Lisa?
Is it 8? What is the years? 8.
8
No,
years
not eight.
prior to
If
2000.
you were hired prior to October 1, 2008, then you have a certain set of criteria.
Oh.
But like the one that Bump and Britt were under was how many years of service?
When were you hired?
January 1st, 2011, yep.
Right, if you were hired
Wow.
after 2008, you've got to have 25 years of credible service.
Yeah, I was.
And that's what gets you.
I am nowhere near that one.
13 more years by you?
There you go.
Yeah.
All right.
I mean, so there were decisions made by that council back then to make some cuts. And again, I think what y'all are gonna be recommending council is what we can do now to make this Cadillac more like a Honda Accord.
So the RHRA, I wonder, of those that are eligible, how much money is not, how many people use the money? I guess, what's the cumulative amount?
At the end of the year,
At
how many
risk.
people don't use it all?
Yeah, what's the cumulative amount that's at risk? How much is used for 2022, 2021, 2020? Give us some idea. May not impact that many people anyway. You follow what I'm saying?
As far as them using the funds?
Yeah,
So your question is, what is the carryover?
Or what
each
they're
year?
rolling over.
Yeah.
Are you
Rolling
asking
over.
how much of it they're
we
using?
don't have to roll
Yeah.
over though, we could cut the rollover
Yeah.
off, obviously.
Yeah.
Cause like,
Let's understand what the
Well, that's kind
utilization.
of where I was going. If
$4,200 a year that goes in the account. And you're asking how much of that 4,200 is used, right? We got X employees, we could sit down, Lisa, we have that information, don't we?
Is that a valid question as we evaluate this? Cause
I mean,
if they don't use it, you're telling me it rolls over and now they're building, they're
They
accumulating?
can.
Well,
About like
it's a,
6
I
days.
think it's a good, it's a measuring stick, right?
Yeah.
To say what is left each year as a, you know.
Cause I mean, Lisa, do you know any of the balances off the top of your head in those accounts? But we can see them, right?
Yeah.
Okay, and we can look at that because here's how I'd be telling, I think, Tom, let's say if you go look at those and we got 50% that have a balance of at least $10,000.
Mhm.
Well, we're probably putting too much in there, would be
Well,
that's what he would
exactly.
tell me.
Yeah.
Yeah,
Right,
Sure.
yeah, that's right, that's right.
And that's taxpayer money.
yeah.
Yes,
Yeah,
sir.
that's, yeah, so you're right, you're tying up taxpayer money in
It's
that.
not like the Bowater account that's,
Well, let me ask
Robert
this.
Kraft's money sitting in my account.
Yeah, that'd be nice, wouldn't it?
Robert
What if death occurs? Is there a payout? Is there a beneficiary
That
to
goes to the
that?
beneficiaries, doesn't it, Lisa?
If there's a death and they have funds in the RHRA, the spouse can use it up to 1 year. But then I don't think there's any type of payout. I think it stays in the account.
And so then I'm gonna ask the question, has any spouse ever benefited? If you could, y'all could confirm that they have? Do you know how many?
I know that I've worked with some that did, but I don't.
So it accumulates and there's a beneficiary. That's interesting. Man, this just gets deeper. See why I'm asking we're asking these questions?
Is that water getting deeper or is that something else getting deeper?
What?
No, interest being smart out.
What do you say?
No, I
You have
like
to,
you,
you're
like
at
this
the
is
table.
getting deeper.
Is it deeper?
And then, Bump wanted to just clarify, what kind of deeper is
Is it
this?
water? I don't know what I'm getting in.
It's murky water, Bob.
Murky.
Yeah. Wait till this all goes public. It's gonna be murky. All right, well, this is interesting. So the RHRA can accumulate and you got a beneficiary.
And it rolls over. Yeah, rollovers accumulate.
Yeah.
Well, sound like we create some options here,
Yeah.
or some outs.
All right. Any questions about post-retirees? Any more questions?
So how is this money distributed? Is it distributed monthly to them, or how is it?
That, there's an account out there that the money goes into.
Mm-hmm.
And out of that account is where the deductible or premiums are paid for. And Lisa, we still auto draft to their accounts for the retirees share, is that okay? So we're taking money out of the retirees account and I'm here to make those payments.
Mm-hmm.
You said
And if they-
deductibles and premiums.
if they don't-
You mean deductions and premiums or premiums?
No, like see the 840? At least
Yeah.
you tell me if I'm wrong on this. There's $165 that we take out of the retirees account.
Right, one
Okay,
sixty.
we got a draft from their account to pay that. And then the other $675 comes out of the RHRA account that we put in there. And then that pays that. Did I get that right, Lisa?
Sounds
Yeah, for a pre-65,
That's a sweet little deal.
right?
Pre
You're
65.
not paying much or nothing.
But the 675
Not paying much or nothing.
is what you're getting billed from the state.
No.
That plus
The
the
840.
165, 64, which is 840, 64.
Oh,
Yeah.
my gosh.
So,
Keep in
so
mind,
that's
let
not,
me-
that, just
let me
just
try to help you understand.
clarifying.
What-
This money he just said, this isn't going into, this is spent money.
Coming from us.
Yeah.
It's coming from us.
Right. This is coming from the employee, this is coming from us for a total list. This is
Mhm.
spent.
Yeah. That's coming
That's
out.
in
every-
addition to, and keep in mind,
So we
we're
can't
putting this
recapture any of
liability
that
out there
money.
for $30 million.
We can't recapture any of that money. The only money we can recapture potentially would be the RHRA on post-65 retirees.
Well,
So can we, go ahead.
Right?
no, you could, when you say spent, it's put in there monthly. If you already go in there and let's say you're gonna stop doing, spouses and children, just retirees only. So instead of contributing $14.50 into the guy's account, we contribute $675 into the retiree's account.
Because it's for the employee only.
Just for the employee only.
Yeah.
Right.
And all these numbers, and this is again, the actuarials, when I give my audit presentation, I always call them the fancy bean counters. They're the ones that figure up the 840.65 and this and that, what the cost is to us, okay? And all this goes into a big old calculation every year, our financial statements that says, what is our bill? This is what we've got in assets, this is what we've got in liabilities, and it factors in how people live in rising rising cost of healthcare, as well as what investors are doing, and they come up with a number, and right now it's about $30 million. And we're putting $600,000 a year towards it every year, and it has continued to tick up. In the last 5 years, I think it's gone about $10 million.
We're gonna address that, we're gonna get to that, that's a couple of meetings from now. That $350, is that reimbursing an employee for Part B, their supplement in Part D, assuming they take traditional Medicare? It's not reimbursing Part B, it's just the Medicare supplement in Part D, right?
And I just found in the agreement, I'm going to make sure with the RHRA funds roll over for month to month and year to year. What happens when the retiree dies, the unused RHRA funds for retirees who elected retiree-only medical coverage will be forfeited by the retiree and will serve to reduce the county's RHRA contribution for the following year. If they've got a spouse on coverage, the
Just the
spouse
spouse.
can use it for 1 year.
For 1
And then
year.
anything that's left stays in the fund.
Why would someone select, employee only if they have a spouse? Do they pay anymore?
Spouses got coverage somewhere else.
Yeah.
They don't need to cover.
Right.
Yeah.
So it's,
I was just gonna make a quick point, if it's okay. So then, this $350 right here, y'all, if I'm thinking about this correctly, somebody has suggested just an average rate for everybody. So it doesn't matter if you're 65, 75, 85. It's an average rate. So those that are 75-ish or younger are subsidizing the cost for those that are 76 and over.
Yeah.
So then, not that we need to get too far into the weeds, but how many do we have in like 5-year categories? So how many do we have that are 75 or 80? Or 85, 90?
Yeah, this is where, this is a heck of a plan, and if you've been getting it and retired now for 10+ years over here, I mean, I just tell you, I don't think it's gonna be right to make anybody else pay more to further subsidize that than it has been.
Yeah, I'm not suggesting that, I'm saying, but that's the way it's set up
Yeah.
now.
I mean,
It's set up, and I don't even know if we have the
We could
discretion
do the
to
age groups
address
by
this.
5-year increments.
And that's how traditional insurance
so,
cover the
so
cost.
it's interesting how we did
Say it
it.
again.
Isn't that how
because
traditional
we're-
insurances
we're
cover the
like
cost?
Kings
Yeah.
of
younger
layoffs,
paying
you
for
know,
that.
and
Right.
surpluses.
That's
and
what's happening here.
But, in each year, it's like,
I'm just
well,
saying this so y'all
you have an
understand
opportunity to
it. Not that
retire
we have to
this
keep
year,
doing
and
it,
if
just
you
I want you to
do,
understand it.
you're gonna
Sounds
walk
as though how it
out
works.
with what you have
Yeah,
right now,
exactly.
right?
Yeah.
If you don't retire, then you're going to lose this, okay, and you're gonna move to think, so it's like a slow drawback. Like if I had retired last year, that I can't retire until I'm 90, but if I had retired last year, I would have had, I would have gotten additional supplement for insurance after retiring. But I can't retire, so I lost out on that opportunity. And the people that did grab that, they retired, and then everybody had a choice, and they made the choice and they stayed on, and then their premiums went down, or the cost went up on their premiums. So, I mean, I'm just saying that as we come up with a plan here, there may be to say, if you retire now, you can retire with this. If you don't, day one, you're gonna be paying more moving
Well, I
forward.
mean, I see what you're saying. I remember years ago, I interned at USA in San Antonio, and they had something similar to try to encourage people out the door. We are not in the business of the county, we're trying to encourage.
Well,
people
that's
to
the
leave.
problem.
That's the thing.
See, but you're at a different-
We
you're different-
Really want them to
different scope.
stay, and I mean, I think, again, right now, there are 3 categories of these: those that are working at the county, that are eligible to receive this someday down the road; those that are retired up to 65 is the second category; and then those after 65. When I look at those 3 groups, there's one group that I think really needs this benefit, and that's the middle group. Post 65, you have the benefit of Medicare over there.
Mhm.
If you're working, you've got your health insurance there working.
I think might be helpful, I'm not asking for too much work, I apologize, but I'm thinking it might make sense. The 300 that are still working and eligible, give us kind of I think we need a breakdown of how many people, if this is not too much to ask, but as an example right here where it says pre-65, retiree only, retiree spouse, retiree child, full family, how many fall into these how many
Yeah.
people fall into these
Do
categories?
you wanna break down that, like, by?
Just
Because
numbers.
you could also,
like
another
third-
chart that
like
had
you
like
just-
the age of those employees, like
We don't need that.
This money
Well,
59, this money 58, to see what those,
I don't
I'll
think
spread out
so,
those are.
because I had one other thing I was gonna share, and then we're gonna, time's up. Unless, y'all wanna give this 5 more minutes, or you wanna stop and
Two
we'll
and a
pick
half.
up?
We'll give
Two
you
and a
2.5.
half.
I'll
that's
call
good.
2.5,
Just
yeah,
for the
2.5.
record, we can say we did go over, right, when asked about this meeting.
No, we're getting ready to adjourn, just because of that comment. So here's our takeaways. Here are our takeaways.
Oh, there you go.
Our takeaways are that
That's the.
Lisa is going to look into whether we can offer a spousal affidavit to post pre and employees that are still working and eligible. You're gonna look into that, all 3 categories, right? And then we're going to, on this, we're gonna have this with the 300. Just
The
telling us.
current working employees, what they currently have for
Yeah.
coverage.
And then we need the numbers for pre and post. And do y'all want it left in this order? Do you want it post, pre-retired, and then 300, or you want to leave it, the ones that are working? You want to leave it in the order it's in, this
That's
up
fine.
top? That's
We
all
can
right?
leave it, yeah, that's fine.
All right. We
So-
good?
What's that, the third one over there, you wanted what was the third one you asked for?
The third one's good. So you got the employees that are working today, 300 roughly, that are working and eligible.
Okay, you
And
wanted
then
to
the
know
next
those,
one-
how many are single, how many
Yeah.
have children, okay.
Yeah, I think
that,
it's gonna be
okay.
important to
I
know.
thought that was the second, that was the third?
Yeah, just for all 3 categories. So
Okay.
add all 3 categories to the
Okay.
sheet. I think it would be helpful, so we'll have some head
We'll
knowledge here.
put it on the second piece of paper, yeah.
All right, and then we're gonna ask the group that manages the Medicare supplements to explain what's offered to an employee that turns 65 as it relates to Medicare, right? And can we do a Zoom meeting in here, Karen? Do we need to meet somewhere
When's
else?
the meeting, so I can try to get him on schedule.
Yes, ma'am, 4:30, and we set this for the first Tuesday. So this is the first Tuesday of the month, right? Yes, it is.
Yeah, it is.
First Tuesday, 4:30. We good?
Yeah.
No,
Anything
So-
else?
So what, go ahead.
You can't do it?
Oh, I know, I go back to my regular grind time job, April 1st, so I don't know what schedule I'll be on.
All right, let me ask you this question. Can we do this via Zoom? I don't mind doing this via Zoom. Somebody said county won't let you do that crap. Is that right?
That's right.
Well, what the heck, Kendry?
It takes council to
Yeah.
change that.
You can change it, but you gotta have a means for the public to participate in the meeting.
I'm just a freshman councilman. They don't listen to me.
Well, one thing about it, even if
Tom,
I can-
call Allison and get
if I can
it
do it
done.
Zoom, I can be
Like,
here.
as Watt suggested, it'd be good to have these meetings in York going forward. I agree with Watt's on that.
Yeah, right, yeah. Yeah.
I don't think we'll win that one over.
Well, hey, one last comment though.
Next one's gonna be in Fort Mill.
I think it's critical that as we go through this, we wanna make sure the people that are working for the county that, you know, have families and stuff that, look, we gotta keep workers here, working for the
Yeah.
county. So whatever plan we come up with, we gotta make sure the people that are working for that are no, you know,
Yeah.
they're not scared off by this.
And I'm
Because
just gonna say
y'all
this,
have
and one of
to-
the things I look at
We
going
can't
here,
lose anybody.
we've gotta take care of, we got 1,200 employees.
Yeah,
1,250, or 300 of them are still eligible for this. We're responsible for all 1,200 employees, try to keep all of them over there.
Yeah.
And it is a draw of resources for this plan.
Yeah.
And one thing I'd ask the actuary to do is to give a breakdown of the impact on our $30 million liability
Mhm.
if we
When will you know
cut
the
off
schedule?
post-65,
I can find out.
if we cut off
I'll make a call.
Will you
children
let Karen
and
know?
spouse,
Yeah.
and if we cut off the current employees, cut those
Would
off.
you rather join
What would
via
each of
Zoom
those
for work?
do to the impact of the liability?
work,
So
I'll
breaking
probably
that
get
$30
on
million
Zoom anyway.
down by each of those categories.
right. If you're over 65 now, I know you and I will have to deal with it.
You want us to come out there to you?
Hey, the second thing I want to say is motion to adjourn.
Well,
Second.
All right. All in favor?
aye.
There you go.
Thank you. What you think? Thank you, Tom.
All right, thanks, guys.
Oh,
See you,
you're
man. See you, man.
Okay.
Hey, y'all have a good evening.